Welcome to our video on allergic rhinitis, a condition that affects millions of people worldwide. Today, we'll explore the most common symptoms, helping you better understand what to look out for. Allergic rhinitis, often referred to as hay fever, is triggered by allergens such as pollen, dust mites, or pet dander. These allergens cause the body's immune system to react, leading to a variety of symptoms that can impact daily life. Recognizing these symptoms early can help you manage the condition more effectively. Let's start by understanding what allergic rhinitis is and why it's so prevalent. Allergic rhinitis is caused by the body's immune response to airborne allergens. When these allergens enter the nose, the immune system releases chemicals like histamine, leading to inflammation and irritation. Common triggers include pollen from trees and grasses, dust mites found in bedding and carpets, animal dander, and mold spores. Understanding these causes is essential for identifying symptoms and reducing exposure. By knowing what triggers allergic rhinitis, you can take steps to minimize contact and manage your symptoms more effectively. One of the most recognizable symptoms of allergic rhinitis is frequent sneezing. Sneezing is the body's way of expelling allergens from the nasal passages. People with allergic rhinitis often experience sudden, repeated sneezing, especially after exposure to triggers like pollen or dust. This symptom can occur in bursts and may be more pronounced in the morning or after entering a new environment. Sneezing is not only uncomfortable, but can also disrupt daily activities, making it important to identify and manage. Nasal congestion is another common symptom of allergic rhinitis. It occurs when the lining of the nose becomes swollen due to inflammation, making it difficult to breathe through the nose. This congestion can lead to mouth breathing, snoring, and even sleep disturbances. The sensation of a blocked nose is often persistent and can worsen during allergy seasons or after exposure to indoor allergens. Managing nasal congestion is crucial for improving comfort and quality of life. A runny nose, or rhinorrhea, is a hallmark symptom of allergic rhinitis. This occurs when the nasal passages produce excess mucus in response to allergens. The mucus is usually clear and watery, but it can become thicker if there is a secondary infection. A runny nose can be bothersome, leading to frequent nose blowing and irritation of the skin around the nostrils. It's important to distinguish this symptom from those caused by other conditions, such as colds or sinus infections. Itching in the nose and throat is a classic symptom of allergic rhinitis. This sensation is caused by the release of histamine, which irritates the mucous membranes. People often feel the urge to scratch or rub their nose, and the itching can extend to the roof of the mouth or the back of the throat. This symptom is particularly common during allergy seasons and can be accompanied by sneezing or coughing. Addressing the itch can help reduce discomfort and prevent further irritation. Watery eyes are a frequent companion to allergic rhinitis. Allergens can irritate the conjunctiva, the membrane covering the eyes, leading to increased tear production. This symptom is often accompanied by redness, itching, and swelling of the eyelids. Watery eyes can make it difficult to focus and may interfere with daily tasks such as reading or working. Managing eye symptoms is an important part of comprehensive allergy care. Redness and swelling of the eyes are common symptoms for those with allergic rhinitis. The inflammation caused by allergens can make the eyes appear bloodshot and puffy. This can be uncomfortable and may lead to sensitivity to light. Eye symptoms often occur alongside nasal symptoms, making allergic rhinitis a multi-system condition. Proper management can help reduce eye discomfort and improve overall well-being. Postnasal drip occurs when excess mucus from the nose drips down the back of the throat. This symptom is common in allergic rhinitis and can cause throat irritation, coughing, and a sensation of needing to clear the throat frequently. Postnasal drip may also contribute to bad breath and difficulty swallowing. Addressing this symptom is important for maintaining comfort and preventing complications such as sore throat or hoarseness. Coughing is a symptom that often accompanies allergic rhinitis, especially when postnasal drip is present. The cough is usually dry and persistent, triggered by irritation in the throat. It can be worse at night or after exposure to allergens. While coughing is not always severe, it can be disruptive and may be mistaken for other respiratory conditions. Understanding the cause of the cough can help guide appropriate treatment. Fatigue is a less obvious but significant symptom of allergic rhinitis. Constant sneezing, congestion, and coughing can disrupt sleep and lead to tiredness during the day. Allergic reactions also cause the body to expend energy, fighting off perceived threats, contributing to feelings of exhaustion. Managing fatigue involves addressing the underlying allergy symptoms and ensuring good sleep hygiene. Headaches and sinus pressure are common complaints among those with allergic rhinitis. Inflammation and congestion in the nasal passages can lead to a feeling of heaviness or pain around the forehead, cheeks, and eyes. This pressure can be mild or severe depending on the extent of the congestion. Addressing nasal symptoms can help alleviate headaches and improve comfort. Loss of smell, or anosmia, can occur in allergic rhinitis due to swelling and blockage of the nasal passages. This symptom can affect the ability to enjoy food and detect odors in the environment. While usually temporary, persistent loss of smell should be evaluated by a healthcare professional. Addressing nasal congestion can help restore normal olfactory function. Loss of taste often accompanies loss of smell in allergic rhinitis. The sense of taste is closely linked to the sense of smell, so when nasal passages are blocked, flavors may seem dull or absent. This can affect appetite and enjoyment of meals. Addressing nasal symptoms can help restore taste and improve quality of life. Allergic rhinitis can also cause symptoms in the ears, such as itching, fullness, or popping sensations. These occur when inflammation affects the eustachian tubes, which connect the nose and ears. Ear symptoms can be uncomfortable and may contribute to hearing difficulties. Managing nasal congestion can help reduce ear-related issues. A sore throat can develop in allergic rhinitis, often as a result of postnasal drip. The constant flow of mucus irritates the throat, leading to discomfort and sometimes hoarseness. Sore throat is usually mild, but can persist if nasal symptoms are not managed. Drinking fluids and addressing nasal congestion can help relieve this symptom. Snoring and sleep disruption are common in allergic rhinitis due to nasal congestion. Blocked nasal passages force people to breathe through their mouth, increasing the likelihood of snoring. Poor sleep quality can lead to daytime fatigue and reduced productivity. Addressing congestion is key to improving sleep and overall health. Dark circles under the eyes, sometimes called allergic shiners, are a visible sign of allergic rhinitis. They result from congestion and poor blood flow in the small veins under the eyes. These circles can make people look tired and may be more pronounced during allergy seasons. Treating nasal symptoms can help reduce the appearance of dark circles. Frequent nose blowing is a practical consequence of symptoms like runny nose and congestion. This can lead to irritation and redness around the nostrils, and sometimes even nosebleeds. Using gentle tissues and moisturizing creams can help protect the skin. Managing underlying symptoms reduces the need for constant nose blowing. Skin irritation around the nose is common in allergic rhinitis, especially with frequent nose blowing. The skin can become red, sore, and even cracked. Using soft tissues and applying gentle moisturizers can help soothe the area. Preventing irritation is important for comfort and avoiding secondary infections. The allergic salute is a term used to describe the habitual upward rubbing of the nose with the palm, often seen in children with allergic rhinitis. This gesture is a response to itching and congestion. Over time, it can lead to a crease across the nose. Recognizing this behavior can help identify allergic rhinitis early. An allergic crease is a horizontal line that forms across the bridge of the nose due to repeated nose rubbing. This physical sign is often seen in children and can persist if the behavior continues. The crease is harmless but indicates ongoing allergic symptoms. Addressing the underlying allergy can help reduce the need for nose rubbing. Frequent throat clearing is a symptom caused by postnasal drip and irritation in allergic rhinitis. The need to clear the throat can be persistent and may interfere with speaking or eating. Addressing nasal symptoms and staying hydrated can help reduce throat clearing. Voice changes, such as hoarseness or a nasal tone, can occur in allergic rhinitis. These changes are usually due to irritation and swelling in the throat and vocal cords. Voice symptoms are often temporary and improve with proper allergy management. Difficulty concentrating is a symptom that can arise from persistent allergic rhinitis. Constant discomfort, fatigue, and disrupted sleep can make it hard to focus on tasks. Addressing allergy symptoms and ensuring good rest can help improve concentration and productivity. Mood changes, such as irritability or sadness, can occur in people with allergic rhinitis. Persistent symptoms and poor sleep can affect emotional well-being. Managing allergies and maintaining a healthy lifestyle can help stabilize mood. Reduced productivity is a consequence of allergic rhinitis symptoms like fatigue, poor concentration, and disrupted sleep. These factors can make it difficult to perform at work or school. Addressing allergy symptoms can help restore productivity and improve quality of life. Allergic rhinitis symptoms can be seasonal or perennial. Seasonal symptoms occur during specific times of the year, such as spring or fall. When pollen levels are high, perennial symptoms persist year-round and are often triggered by indoor allergens like dust mites or pet dander. Understanding the pattern of symptoms can help guide treatment and prevention strategies. Children with allergic rhinitis may display unique symptoms, such as the allergic salute, nasal crease, and frequent nose rubbing. They may also experience sleep disturbances, irritability, and difficulty concentrating in school. Early recognition and management are important for supporting children's health and development. Adults with allergic rhinitis often experience symptoms like nasal congestion, sneezing, runny nose, and fatigue. These symptoms can impact work, social life, and overall well-being. Addressing allergies with proper treatment can help adults maintain productivity and quality of life. Seniors with allergic rhinitis may experience symptoms similar to younger adults, but they can also face additional challenges, such as reduced sense of smell, increased fatigue, and complications from other health conditions. Proper management is important for maintaining health and independence. During allergy seasons, symptoms of allergic rhinitis can intensify. High pollen counts lead to increased sneezing, congestion, and watery eyes. Monitoring pollen levels and taking preventive measures can help reduce symptom severity during these times. Indoor allergens such as dust mites, pet dander, and mold can trigger perennial symptoms of allergic rhinitis. These symptoms include nasal congestion, sneezing, and itchy eyes. Reducing exposure to indoor allergens is key to managing year-round symptoms. Outdoor allergens like pollen from trees, grasses, and weeds can cause seasonal allergic rhinitis. Symptoms include sneezing, runny nose, and watery eyes. Limiting outdoor activities during high pollen times can help reduce symptoms. Distinguishing allergic rhinitis symptoms from those of a cold is important. Allergic rhinitis usually causes clear, watery mucus, frequent sneezing, and itchy eyes, while colds often produce thicker mucus and may be accompanied by fever. Knowing the difference can help guide treatment. Sinus infections can cause symptoms similar to allergic rhinitis, such as congestion and headache. However, sinus infections often produce thick, yellow, or green mucus and may cause facial pain and fever. Allergic rhinitis typically does not cause fever or colored mucus. Asthma and allergic rhinitis often occur together, but their symptoms differ. Allergic rhinitis affects the nose and eyes, causing sneezing, congestion, and itching. Asthma affects the lungs, causing wheezing, shortness of breath, and chest tightness. Understanding the differences helps in managing both conditions. COVID-19 symptoms can overlap with allergic rhinitis, but there are key differences. Allergic rhinitis does not cause fever, loss of taste or smell is usually temporary, and symptoms improve with allergy treatment. COVID-19 may cause fever, persistent loss of taste or smell, and body aches. Recognizing these differences is important for proper care. Allergic rhinitis is a chronic inflammatory condition of the nasal mucosa triggered by exposure to allergens. It is characterized by symptoms such as sneezing, nasal congestion, runny nose, and itchy eyes. Understanding this concept is key to recognizing and managing the condition effectively. Histamine is a chemical released by the immune system in response to allergens. It plays a central role in the symptoms of allergic rhinitis, causing itching, sneezing, and increased mucus production. Understanding histamine's function helps explain why allergy medications target its effects. An allergen is any substance that triggers an allergic reaction in susceptible individuals. Common allergens include pollen, dust mites, pet dander, and mold. Identifying allergens is crucial for managing allergic rhinitis and preventing symptoms. The nasal mucosa is the lining of the nose that plays a key role in allergic rhinitis. When exposed to allergens, the mucosa becomes inflamed, leading to symptoms like congestion and runny nose. Protecting and caring for the nasal mucosa is important for symptom management. Postnasal drip refers to the movement of excess mucus from the nose to the throat. It is a common symptom in allergic rhinitis and can cause throat irritation and coughing. Understanding postnasal drip helps in managing related symptoms. Allergic shiners are dark circles under the eyes caused by congestion and poor blood flow. They are a visible sign of allergic rhinitis and can help in diagnosis. Treating nasal symptoms can reduce the appearance of allergic shiners. In summary, allergic rhinitis presents with a range of symptoms including sneezing, nasal congestion, runny nose, itchy eyes, and more. Recognizing these symptoms is the first step toward effective management. Whether symptoms are seasonal or perennial, addressing triggers and seeking appropriate treatment can greatly improve quality of life. We hope this video has helped clarify the most common symptoms of allergic rhinitis and provided useful insights for managing the condition.